organ donation in Cameroon, a myth or necessity, the case of cornea grafts. The moderator for this segment will be Jean-Bruno Tanye. On the panel, we have Professor Pr.OYELEYE Abiola, President of the Ophthalmology Society of Nigeria, Professor BINGONO, anthropologist, Dr. TOSHNIWAL, cornea specialist from India, Dr. NGWE, Eleanor, our own very cornea specialist, and Madame Ngomok is a beneficiary of cornea grafts. Ladies and gentlemen, we welcome you to the podium. And let's take our seats and prepare to begin. Moderator, over to you.
Mesdames et messieurs, bonjour et très heureux d'être parmi vous ce matin pour ce 29e congrès annuel de la Société camerounaise d'ophtalmologie. Et le débat qui va nous concerner tout à l'heure porte sur le don d'organes au Cameroun, mythe ou réalité, mythe ou nécessité, le cas des greffes de cornée. Alors c'est une question certes médicale, mais c'est un débat à la fois philosophique, sociologique et même anthropologique quand on sait la place que le corps occupe dans notre culture, dans la culture africaine et même, si on veut, dans la cosmogonie africaine. Et donc, pour parler de ce sujet, nous avons invité de nombreux spécialistes dans le domaine de l'ophtalmologie. Et pour animer les échanges ce matin, je ne serai pas seul. Je vais vous prier, mesdames et messieurs, d'accueillir Bernard Agbor, s'il vous plaît. On va applaudir. Merci. Alors, Bernard Agbor, qui est communicant, certes, mais davantage, il est membre de l'Agence internationale pour la prévention de la cécité. Alors, pour continuer, avant de continuer, je vais permettre à Bernard de dire un mot introductif de ces échanges. Cette fois, ce sera en anglais. Bernard, thank you very much. Welcome.
Thank you very much, ladies and gentlemen, and dear Congresses. We are glad to be here on this roundtable that will be touching something very, very special like cornea and cornea issues. We want to be acknowledge and appreciate the presence of the President of the Cameroon, the Nigerian Ophthalmological Society, Dr. Toshniwal and everyone who are here. We wish to just say that in the context of the world, following statistics from the International Agency for Prevention of Blindness, IAPB, 1 out of every 70 cases of cornea issue is met. So the need is 60 on 70. So we will be talking a lot today, and there will also be an opportunity for us to ask questions and have an understanding, and let's see how we push this forward in our country, Cameroon. Thank you so much. Thank you, Jean-Bruno.
Merci infiniment, Bernard. Mesdames et messieurs, pour présenter ceux qui vont intervenir ici devant vous ce matin. Le premier, c'est le docteur Abiola Oyele. Il nous vient du Nigeria, il est ophtalmologiste bien sûr, président de la Société nigériane d'ophtalmologie, que je vous prie d'applaudir s'il vous plaît. Et juste à côté du docteur Abiola, nous avons un autre médecin. Cette fois, il nous vient de l'Inde, c'est le docteur Navneet Toshniwal, qui est médecin spécialiste de la cornée. Il est très actif dans la recherche sur les questions oculaires et il a publié de nombreux ouvrages, dont un sur la cataracte. Mesdames et messieurs, merci de l'applaudir. Ensuite, nous avons une digne fille du Cameroun, le docteur NGWE, Eleanor. Elle a été formée en Israël, elle est médecin et spécialiste de la cornée. Elle est très active sur le terrain de l'humanitaire, a participé et organisé même de nombreuses campagnes gratuites sur les questions de vue, notamment à Bamenda. Mesdames et messieurs, merci d'accueillir le docteur NGWE, Eleanor. Merci. Alors, ce n'est pas terminé. Nous avons à côté de moi Madame MOUG, c'est bien ça, et elle est un témoin vivant de ce que peuvent, des miracles de la médecine. Vous êtes tous des spécialistes, je n'en dirai, je ne peux pas parler davantage du sujet, juste pour dire qu'elle a reçu une greffe de la cornée. Son expérience nous intéresse au regard du thème qui sera abordé tout au long des échanges, et je serai tout à fait complet lorsque j'ajouterai qu'elle a fondé l'association oui. Voilà, ok, voilà. Et donc, elle nous en parlera un peu plus. Mesdames et messieurs, merci de l'applaudir pour son expérience. Voilà, nous allons partager son expérience avec elle ce matin. Sans plus tarder, Bernard, on va passer aux échanges proprement dits, passer la parole à nos spécialistes ici présents.
Thank you, Jean-Bruno, and we will be moving straight to Dr. Eleanor. In 2020, I think from 2020, there was some studies on the pathologies, pattern of corneal pathologies in children seen at the Yaoundé Gyneco Obstetric and Pediatric Hospital. I think this was study done by Professor Bella, Professor Dovoma, Professor Andre Ebal, and Dr. Omar Abdurrahmani, and many others. And this was very shocking. Listen, everyone. It says that of the 7,922 children seen over the study period, 168 had corneal pathologies, giving a prevalence of 2.1%. Dr. Eleanor, is this very serious for Cameroon?
Thank you very much, Mr. Agbo, for having me on this platform and with these questions. Thank you, everyone present and fellow Congress participants. I think the corneal problem in Cameroon is a very, very serious one, and I'm very happy that we are putting an accent on it, and that's why we're having this Congress this year with a theme on cornea and cornea as ocular surface pathologies. I think that what Professor Bella rightly brought up in her report and her publication is just the tip of the iceberg. These are just children that live in Yaoundé, Mills probably and its environs, who can afford to come to the hospital and get the diagnosis. I work in the periphery, and the situation there is cruel. I mean, it's not just children. I mean, in children you have the problem of the amblyopic component, where because of the corneal scars, sometimes we see them as adults and you cannot do a corneal transplant because they're amblyopic already. But we see a lot of adults. I mean, a lot of adults. There are studies on unilateral blindness, and we see a lot of adults that have corneal pathologies, and for many years they've been told that there's nothing anybody can do about it. So just to tell you how bad it is, more than 90% of people who have corneal infectious keratitis that affects the visual axis will end up needing some kind of corneal rehabilitation and corneal transplants. And we know that the problem in Cameroon is not just the lack of the technical plateau, but the cost of this service. I was very happy when Magabi came up and they started doing some corneal transplants, and now we are hearing about CSU, Professor Kameni. We are very happy to hear this, and I think the future, it's going to be better definitely as we meet here.
But I think, Jean-Bruno, I was just going to ask her again, what are the challenges? What's blocking this to happen in Cameroon? You spoke about the technical platform, which is not necessarily the problem, but I guess some issues on legislation and government action, I guess.
Thank you very much. You know, the government is the people, right? We all thought that. But legislation can only come when the people themselves are aware, first of all, of the problem, and that the solution is very possible and around them. I make it a point each time I meet medical professionals, not necessarily ophthalmologists, to ask them, like, do you think organ transplants are possible in Cameroon? They're like, maybe, you know, some kidneys were transplanted in Hôpital Général sometime. And when I tell them, do you know that cornea transplants are possible? They're like, we need to do testing, like your brother, it has to be your sister. So we are really not aware that the cornea does not need as much to set up an eye bank in Cameroon than it will take to set up maybe for other big organs. You know, when you read literature, cornea transplant is tissue transplant. It's not an organ transplant, so it's not as complicated. Now, I think that when we raise awareness, then we will have a big way to force our legislations, our legislation, and then we will be able to, you know, say, you know, we cannot keep letting our people go blind for solutions that are around us. We cannot keep importing corneas from abroad. I think it costs like 2.5 million to get a cornea transplant in Cameroon. And then most of these people, even when they go do it, you know, you do it in Cameroon and then you get lost somewhere in Akonolinga, or you go to Frawa and then you don't know who is going to do your follow-up, or you go abroad. I see a lot of patients after cornea transplants, they go abroad, they come back, they don't have a proper follow-up, so they end up having rejections and failures and all of that. So I think that there's awareness, there's legislation, and though I said the technical platform is the least of the problems, but it's still a problem. So I think those are the challenges we face, and we will all tackle that as the school, right? Yeah.
Thank you, Dr. Shea. Alors, qui évoquait effectivement l'importance des problèmes ou alors des maladies liées à la cornée au Cameroun. Et vous avez noté quelque chose que je trouve assez important quand même dans votre propos tout à l'heure, c'est le fait que le problème, ce n'est pas le plateau technique au Cameroun, mais davantage le coût pour une telle opération liée à la cornée, et également un problème d'éducation sur cette question. Alors, nous allons aborder le même sujet pour essayer de voir comment ça se passe du côté de l'Inde avec le docteur, pardon, je vais retrouver son nom, le docteur Navneet Toshniwal, voilà, qui va nous partager un peu l'expérience de l'Inde en matière de transplantation de la cornée.
Can you translate what?
So, Dr. Toshniwal, Jean-Bruno was just saying that Dr. Eleanor has been able to situate the context in Cameroon and made a lot of challenges, legislation, awareness, education, and all of that. But then she thinks that Jean-Bruno is wishing to know what's happening in India. Just to say that India is the second largest number of transplants per year, according to statistics from IAPB. And we want to know from you the Indian context and how you took this on. Thank you.
Thank you, Akbar. Everybody on the stage, Professor Manga. Thank you for inviting me for this different type of symposium, and which is the most needed. As Madam has rightly mentioned, that difficulties with everything is a man-made. It's everywhere is a person. So legislations and all that is still manageable. Most important thing is that awareness. This is my point, which I have seen about the strategy of India. 25-30 years before, India was having the same questionnaires.
That's right.
And now, in town like at my town, it is 1.5 million, still it is big. We started an eye bank in 1988. First we received 2 corneas per year, 4 corneas per year. Now we are getting 120 corneas per year.
Wow. I think it's a place to put our hands together.
So that is the, I think, awareness. Every time we talk on awareness, My simple strategy is that first awareness in among the doctors. Doctors should be ready. There should be one senior, middle-age, junior, such a type of three-tier system should be ready to go and collect corneas at any time of the day and night. So that is the awareness in the doctor. Once it starts, all other factors will automatically work. Then nurses, then technicians, then team, then set of instruments, then everything we can start. Just giving, now there are some cities in India, they just talk on eye donation, do eye donation, do eye donation. But whenever there is a need, they call us. Can you go and collect the corneas? My nearby district. So that's not the point. That's the first is there should be, and money is not the problem any part now for eye donation. Money is not the part. There are one great donor 15 to 20 years before came at my clinic. He was talking with my father in one of the city near my city, Gulbarga. They wanted to start an eye bank. I have money, I can give the ambulance, I can give this thing. My father has asked only one question, tell me two names of the doctors who are ready to do eye donation. So that is I think, very important. And then promotion and all that we can do. I have brought one eye donation clip where you can exactly see how the eye donation can be done and all that. It's so easy and so simple. And that maybe if time permits, I can show it 6 minutes video.
Thank you, Dr. Toshniwal. Dr. Toshniwal a évoqué des éléments très importants, l'acceptation. Ok, il faudrait que les ophtalmos puissent accepter, n'est-ce pas, à participer dans cette mouvance, Jean-Bruno Tanier. And he was actually saying that if there is a way, he could flag a video on how cornea eye banking was done in India. Si vous le permettez, Monsieur le modérateur.
Yes, you can. On peut le faire là, le temps de prendre également, pendant que le technicien se prépare, le temps de donner la parole au Nigeria, parce que le docteur Toshniwal a évoqué quelque chose de très important, c'est-à-dire qu'il y a 25 ans, l'Inde était dans la même situation que le Cameroun. Donc il y a eu une évolution non seulement des mentalités, mais également au niveau voilà, de la prise en charge et tout pour améliorer la situation. Is the video ready?
Yeah, video is ready. Professor, belong. Ready?
Voilà, mesdames et messieurs, nous allons regarder tous ensemble. Voilà. Ça va nous prendre exactement 7 minutes. Je pense que le jeu en vaut la chandelle. Voilà.
Oh, yes. Not started. In between it has started. Okay. This is the corneal button. What we are getting, then we preserve in the very simple solution in the MK media or corneal. Its steam is always ready. 2 sets of instruments are ready any time, and we can go and we can collect these corneas. And the preservation is...
S'il vous plaît, les inscrits aux ateliers pratiques, ils sont ouverts. Si vous pouvez vous retrouver de ce côté-là pour les sessions.
You have to go to any place, maybe house. This is the mortuary room where already it is preserved, a cryo preservation like things, and you can see the 3 to 4 millimeter of the sclera with cornea. Even while cutting the cornea, I take precaution not to give on any folds on the cornea, so we can get the good quality of the tissue. And this is the very special precaution what we have to do, that the body should not be there, should not be disfigurement of the face. That is very, very important, so that people can get promoted, ready, they can tell to their relatives. This is I am talking with the relatives, talking with the doctors who were with me to give them this type of knowledge of eye donation practically. At the home side, visit to the home side is also very important. We have to remove these corneas in a very awkward position. So many times I just take a simple stool also with me so that I can sit comfortably and I can remove the corneas. It's not very big equipment needed for the corneal eye donation collection. It is a good scissor, some cotton, taking the suture from upper eyelid to lower eyelid or the glue. These are the very simple kit. We can keep ready. I have kept 4 to 5 kits ready by ETO. So whenever there is a call, just to collect that kit, collect the drum, and we can go to this thing. There is many different ways. What is the environment there? This is a very classical picture of environment. This you can show to the people. I am collecting the corneas and their relatives are doing worship there. So we can say that along with this worship, I am removing these corneas. Definitely it is a very positive vibrations are there to collect these corneas and to put these corneas, and this is the way you can motivate people that yes, this is a very good environment. And you can inform immediately, no need to information because you are practically going there, removing there. Next time among their relatives, if there is such a type of eye donation call, they will immediately call you. It's not a very big procedure. You have to give your one phone number and your hospital number. They just connect there, contact there. And in Solapur, in my place, we reach at the site in 20 minutes. It's not very rush areas and all that. And you should be always thankful. This is my father, Dr. Sham Toshniwal, pioneer of this eye banking at my area. He used to go personally. In those days, there is no technician and all that. I have 3 technicians right now. But in those days, this is what I am telling right now, what is the situation in Cameroon. First, these senior people, the interested people should go there, and once they start, junior team will start doing these eye donation activities. I was watching this, I have mentioned this point in Nigerian conference also. I am watching this activity since my childhood. So automatically it will come in the blood to do such a type of work in the routine. And this is again in the hospital, in the mortuary, in the residence, anywhere there is a call. Sometime I have to go to the postmortem room also, but I have started rejecting those corneas because that is the infected areas. 2 of my patients have damage, means there is a infection post-op. So I am not going now in a postmortem room at least. So if there is some case of a police case and all that, we request directly to the authority. If they allow us, we can collect the corneas and we can write down the notes and all that. So this is I have this film on eye donation. I have made 7 films like this, and every year there is a 25 August to 8 September. I think this is very important, interesting point of India. This is called as a fortnight. That in that time, every year there is an activity of this eye donation throughout India. Every part of the India, 25 August to 8 September is eye donation fortnight. So give lectures, promote the things, rallies, hoardings on the roadside, main areas. I think this will automatically give idea about this awareness among the general public. So the general public awareness is very, very important. Apart from all the things, issue of the religion, myths and all that, we should start ourselves this work from our side and to do the better thing. Then this is the surgical video. I am not going in detail in the clinical things. My point is that awareness is very important. And when we can do in Cameroon also like this, 1 week, 2 weeks per year, and all the ophthalmologists will participated in such type of program. In near future, after 4 or 5 years, there will be a completely different picture about this eye donation, eye banking activities anywhere, wherever you start. Thank you, sir. Thank you, Paul.
Thank you very much. Voilà. Donc, vous avez été témoin un peu de ce qui est fait par le docteur Toshniwal dans son pays pour essayer de collecter la cornée qui va permettre de sauver des vues. Quand on voit ça, on se met à rêver qu'une telle chose soit également possible au Cameroun, où on peut avoir, pourquoi pas, rêvons, une banque de cornée qui permettrait de sauver la vue d'un certain nombre de compatriotes. Et il a insisté sur le fait qu'il faille voilà, avoir une sensibilisation très très importante des populations, des praticiens eux-mêmes également sur l'intérêt d'une telle chose pour que une telle opération ne soit plus un tabou, parce qu'il parcourt les hôpitaux, y compris des morgues, pour essayer de récupérer la cornée pour sauver des vies. Thank you, Mr. Toshniwal. Et on va passer la parole au docteur Abiola pour voir la situation au Nigeria. Tell us, doctor, is this possible in Nigeria?
Thank you very much. Good afternoon, everybody. Good afternoon to people in the panel.
Good afternoon.
And Dr. Manga, let me say thank you very much for bringing me here, so that you won't forget to bring me again next time. When Dr. Eleanor was talking, I remember that in the Nigerian National Blindness Survey, we found out that one of the most common causes of corneal blindness is post-cataract surgery. The doctors are one of the most common causes of corneal blindness. To be specific, the ophthalmologists and the traditional people who do the couching, we cause corneal blindness. Now, about 20 years ago, Nigeria opened a corneal bank, 2004. Our present president, who was the governor of Lagos State, and he did free eye program. And they found out that anytime they do free eye program, that is where the most people go for medical services. They want glasses, they have cataract surgery. So in 2004, we formed the corneal bank. But it took us 4 years before the corneal bank started working, 2008. And between then and now, guess how many corneas we have harvested? 3 or 4. Ondo, Twa, Cat. Solmo.
I know.
And it is sad that we've done this for many years. And why are we having this problem? And it's something that I'm sure will happen in Cameroon, or has happened in Cameroon. Number one, cultural beliefs. Cultural beliefs. Anybody wants to die, I want to go back complete. Yes. Then religious beliefs. The Muslims bury within 1 day, and they don't, they don't want anybody coming to tell them anything. They want to bury their dead. Even if you go and do advocacy in a church, you tell the Reverend Father, I want to talk about corneal donation. He will say, come to the next service. This is my service. Come to the next service. So that is a major challenge we are having. Technical challenge is there, but the major challenge is acceptance of the population. And if you cannot get around that, then we are not going to start anything. advocacy is the number one thing that has to be done. And he mentioned talking to doctors. We are advocating talking to medical students when they are medical students. Then when they are doctors, talking to doctors as well. And then other health care workers. Because as Dr. Eleanor said, healthcare workers don't even know what corneal graft is about.
Yeah.
And anybody working in that sector, anybody can ask you a question. If you can answer properly, it increases their awareness. So there are a lot of things that, rather than take 20 years to get to where Nigeria is now, if you learn from our experience, you might get there in 5 to 8 years. So that's why collaboration is always very good. Thank you.
Super, super, super. I think that we are very encouraged by this statistics coming from Nigeria that says that 20 years.
So let me just correct an expression.
Go ahead.
We've done about 100 grafts. Not that we haven't done anything.
That's right.
It's just that we are importing. But the ones that we have harvested, 3 to 4. And sometimes you put your name down that I want to donate my cornea. And when you die, they go there, the children say, no. No way.
But doctor, I was just wondering, where do we get and how do we get this well all along, taking into consideration our cultural and religious beliefs? Is there something that we may do within the lines, medical lines, to bypass these cultural and religious beliefs?
I only came here to answer simple questions. Let somebody answer the difficult questions.
Thank you very much. Mais, docteur, ça c'est très intéressant. Il a dit dans 20 ans, le Nigeria parvient quand même à avoir 3 à 4 cornées. Et il pense
c'est déjà pas mal quand même.
Oui, quand même. Et il faut le rappeler, le Nigeria, c'est 300 millions d'habitants. Voilà, c'est 10 fois plus que le Cameroun. Donc, il y a un grand défi, Jean-Bruno, qui nous attend.
Oui.
Voilà, mais je pense que ensemble, nous pouvons trouver une solution. Merci.
Alors, le docteur Abiola, effectivement, a touché le point, c'est-à-dire qu'il explique que le problème, et le docteur Sheila également dit, sur le plan du plateau technique, il n'y a pas de souci, les compétences sont là, mais on fait face encore à un certain nombre de barrières, d'abord culturelles, parce que, voilà, on est africain, et même quand on meurt, on aimerait repartir entier et non avec le corps un peu mutilé. Il y a également les barrières religieuses parce qu'il y a des gens qui estiment que bon voilà, on n'a pas à toucher le corps que Dieu a fait. Voilà. Et enfin, le plus grand problème, et ça c'est le plus important des problèmes, c'est l'acceptation, que la prise de conscience des uns et des autres sur la nécessité de pouvoir sauver des vies grâce justement à ces dons d'organes. Par contre, il y a quelque chose que j'arrive pas à comprendre. Il y a bien des banques de sang dans nos hôpitaux.
That's right.
Je ne sais pas quelle est la différence entre le sang et peut-être la cornée.
Blood banks and cornea banks, yeah, they exist.
Donc,
They exist.
ça, c'est une question qui reste. Oui, enfin, le sang, il est liquide, la cornée. Et après, voilà, quand on voit quand même la chirurgie telle qu'elle est pratiquée, c'est une chirurgie qui est assez pointue quand même.
Yeah.
C'est assez pointu. On a vu des images tout à l'heure. Et évidemment, on peut comprendre un certain nombre de réticences parce que quand quelqu'un va assister à ce genre de chirurgie sur son défunt père, fils ou mère, ça c'est pas quelque chose de facile à accepter. Mais on devrait pouvoir aller vers là. Et s'il y a quelqu'un effectivement qui a souffert de ces préjugés, de ce tabou du don d'un organe qu'est la cornée, c'est bien vous, madame. Vous avez été greffée de la cornée. Vous allez nous expliquer comment cela s'est passé et si je comprends bien, cela n'a pas été fait au Cameroun. Voilà.
Okay, thank you to everybody. thank you to Dr. Manga, who is my doctor. I think this is close of 12 years that he's following me up today. He's the one who diagnosed me Kératocône in 2013. And finally, I went for surgery in 2017. I do surgery in 2 countries, in Kenya and in South Africa. And when they diagnosed me Kératocône in 2013, it was just like a sound. I did not really measure what this means to have a Kératocône. But I went to some documentation. I started reading about Kératocône. I understood that is not, because I was asking myself, why is the whole family, I'm the only one who have that kind of disease? And find out that it can happen to anybody to be in that situation. And by then, they were saying that it's a very scarce disease. One people under 5 million have Kératocône. You need to go through. I was a bit scared. But that, thank God, with the assistance of my husband, we find an NGO in the United States. They call Lion Eyes Institute, who's now Lion World Institute. We get in contact. We send them all our report. They go through the report and they say that they can assist me because they wanted me to fly to the United States for a surgery. But the fees of, let's say, hospitalization, all those things, because they were giving me the cornea for free, and I just pay for my accommodity. It was close to $100,000, which is 65 million Cameroonian money. It was very huge. And they say, okay, they can advise me to go because they have a process in their NGO. They train doctors. You can be a doctor, you're willing, you come to the United States, they train you, and in case of need in your country, they can send you a cornea, a tissue, for free. Unfortunately, I was the first in French Africa, even in Africa, to get in contact with them. This is where come out the association that I created, Gracious Vision, is to put in contact those who are Kératocône diagnosed with them. They can provide them free tissue. Yes, it's free tissue. Yes, they can do that. Send you free. They pay everything to me. I just pay the surgery. I pay everything I was supposed to be paying the hospital. My total bills was close to $10,000 because I did not pay the cornea. Because if I was paying the cornea, it was close of $30,000 or $25,000. And until today, we are still in contact with them. And my experience of this thing is that it's not easy, but that is right. Dr. Manga, each time that I go to Dr. Manga, I spend 3 hours in his office. I remember when I came back for the surgery, he was very afraid. Each time that I went there, that my eyes is red. He said, Madame Ngomou, je veux pas que tu fasses le rejet. Faut pas venir faire le rejet ici. I said, no, I'm sure that there's not going to be no retake of the cornea. After the cornea, cataract enter. I went to cataract. After cataract again, another one enter. That's why I say Dr. Manga is a Superman for me. I'm there to just, not a joke, because it can make your life a bit uncomfortable. I am a banking profession, and you can imagine that for you to read a book or you read a customer note, you need to make 10,000 effort. It's not good, personally, because even glasses is not enough for you. When you have a Kératocône, you don't need to wear glasses because it's not the problem that you say -1 or -2. It's just that your cornea no longer existing. Because when I was in the phase that did not have a cornea, all was eyes. That sunlight was very strong for me. Yes, when the sun like that, I cannot go out because I did not have nothing in my eyes. Yes, and it's for the both eyes. It's not just one eye; it's the both eyes. And my vision today is to, as those doctors say, something that is very important, to bring awareness. Because awareness can barrier. I believe that. Because when people are aware of certain situations, you don't have option just to find a solution. This is, for me, a main problem, because if we can assist people, because costly there, it's very costly for Cameroonian to spend 3-4 million. Who can afford that? It's not every Cameroonian. No, if we can bring people some awareness and to talk to government to help us, to give us some authorization to make campaign, to sensitize people, to talk to them about this disease who's killing people. That does not have age. Everybody can get the Kératocône. As she said that kids are diagnosed with Kératocône problem. Is for me, is going to be a very big victory in Cameroon if we can go through certain process and allow even the lower citizens in the village to be benefit of that. This is my focus in my main problem. This year I have another appointment in Antestate, and this time around is to really see the impact for that issue of cornea tissue there in Cameroon. And I talked to my doctor, Dr. Manga, and I think we'll make a way to that, to make it possible for the less privileged to be benefit of those kind of surgery.
Merci. Alors, Madame Ngomou, vous pourriez être carrément le porte-flambeau de ce plaidoyer sur la collecte des cornées pour essayer de sauver la vue de nombreux Camerounais. Et donc, vous avez été diagnostiqué en 2013, c'est bien cela, par le docteur Che, bravo. Et donc, docteur Manga également, Théodate Manga. Et ensuite, en dehors de la cornée, après vous aviez la cataracte et tout. Alors, je voudrais, mesdames et messieurs, que vous soyez témoins avec moi des prouesses de la médecine. Alors, quand on regarde ces beaux yeux, est-ce qu'on a même une idée qu'on a fait une opération, qu'il y a une greffe? Parce qu'une opération, c'est une chose, mais une greffe, une transplantation d'une cornée sur ces beaux yeux, est-ce qu'on ressent quelque chose? C'est pas joli, ça? Voilà.
Je veux juste ajouter quelque chose en disant que
madame, allez-y.
On m'a anesthésié un côté dont j'ai été témoin de mon opération du début jusqu'à la fin. C'est docteur Oshi, c'est une Indienne qui m'a fait la chirurgie, parce qu'on est parti d'abord en Afrique du Sud, après on est parti au Kenya, parce qu'on a commencé au Kenya pour finir en Afrique du Sud. Et j'ai vu comment ça se passe. Le plateau technique, c'est vraiment une chose aussi. C'était fantastique. On te met un appareil, on sort carrément ton globule, ça sort. Comme tu vas comme dans les dessins animés, ça sort. Après, on prend la cornée qui est comme le cas du poisson. On te pose, les aiguilles, hein, ça passe. Tu vois comment on te coupe. Mais c'est fantastique. C'est vraiment fantastique.
Oui, c'est impressionnant. En effet, on va passer la parole cette fois au docteur Che. Alors, qu'est-ce qui fait problème aujourd'hui? Parce qu'il faudrait bien qu'on avance. On comprend bien, elle a dû dépenser pas moins de $10 000 pour se faire transplanter, pour se faire une greffe. Voilà, parce que la cornée était justement gratuite, grâce à une association américaine justement qui a accepté de vous donner une cornée gratuitement. Donc $10 000, et là on ne compte pas tous les autres frais connexes qui ont permis voilà, d'en arriver à cette situation. Or, si on avait au Cameroun une banque de cornée, je suis sûr qu'elle aurait dépensé beaucoup moins d'argent que cela. Alors, question docteur, aujourd'hui, qu'est-ce qui fait problème? Vous avez parlé de la sensibilisation des barrières culturelles, mais il faut bien qu'on dépasse toutes ces barrières culturelles, religieuses et tout, pour en arriver à la situation où on peut aller à l'hôpital, trouver une banque de cornée et sauver la vue des Camerounais. Qu'est-ce qu'il faut pour cela? Voilà.
Thank you very much. I think the problem is the legislation. I'll give you an example. I'm a cornea specialist. I have already done say almost 500 cornea transplants. 0 in Cameroon. Why? Because one, the patients I see, I work in Bamenda. The patients I see cannot afford to bring corneas from abroad. Now I tell them, I'm talking with the administration, we can do this here, it's very possible. The question everyone asks me is, okay, we are working in a very funny situation. When you go take, you saw the way he took it. I harvested a lot of corneas too, just the way he showed in the picture. It's very easy to do that. You pick up the cornea of someone. Sorry. you pick up the cornea of someone and you transplant. And then they come and say, oh, I did not, you have some kind of legal issue. Who's going to cover you? I remember, I think in 2019, I had a fellowship in the US to work with the Lions Eye Bank. By then I was in residency. And they refused me the fellowship. And I wrote them back and I asked, why did you refuse me the fellowship? I'm already a cornea, I was then a cornea fellow. Why did you refuse me the fellowship? They said, because you're coming from a country where there's no legislation on corneal transplants. So we cannot let you come here because, if we give you the training, you go back home, you might fall into problems and we don't want to get involved in that. So as much as the awareness part is coming, but I'm a corneal transplant, I'm in my village, I'm a farmer doing my farming. I cannot do what I'm trained to do because as a doctor, you have to work in a certain legal frame to be covered from your own side as a medical doctor. And you cannot do that when it's just a gray area in Cameroon. It's not saying don't pick it up. It's not saying do so. It's just a gray area. Nothing is said about that. I think that's what we should work on, and that's the biggest barrier after, the work we need to do to sensitize and to train ourselves and create a platform. Thank you.
What about, quelle est la situation des autres organes? Est-ce que la législation est la même pour tous les autres organes?
No, in places where they have legislature, it's milder for corneal transplant. I said it before when I started talking, that in most places, the organ is considered a tissue. It's not considered an organ. And you don't need to do a lot of tests. If you need to do a kidney transplant, for instance, you need to have a donor that matches your HLA-B grouping and a lot of other tests before you can do a cornea transplant. You don't even need to know the person who gives you a cornea because the cornea is avascular, it has immune privileges, so you can get a cornea from anyone and give to anyone. The main things you need to do is serological testing for things like HIV, hepatitis B, and those are the main things. When there was COVID, we were testing for COVID, because nobody understood COVID. But that's it, and it's, it's something that can be done in hospital. You don't need a huge setup to do that. Thank you.
Voilà, donc en principe, ça ne devrait pas être quelque chose de bien compliqué, juste faire évoluer la législation, Bernard.
Yeah, thank you, Jean-Bruno. When we listen to everyone here, we are looking at awareness as a problem, affordability as a problem, acceptability as a problem. So we will, Jean-Bruno, if you don't mind, there are lots of questions. I can see hands already up. If we can open up that people seek to ask questions and come to it. Thank you.
Alors, je rappelle qu'il nous reste exactement 15 minutes pour mettre fin à ces échanges. Donc, s'il vous plaît, vous posez directement des questions. Et si ce sont des remarques, vous pouvez les faire de manière rapide pour qu'on ait la possibilité de prendre beaucoup plus d'interventions. Merci beaucoup.
Merci beaucoup, Jean-Bruno. Je suis le professeur Kameni du CHE de Yaoundé. Je pense que le grand problème, comme elle dit, c'est la législation ne concerne pas la transplantation d'organes, on en transplante, mais c'est le don d'organes. Il faut qu'on fasse le distinguo. Donc, on n'a pas une législation qui encadre le don d'organes dans notre pays. Ah, et ça, c'est d'un. Et de deux, parlant de la banque de cornée, il faut dire qu'il y a un délai. Quand on a prélevé une cornée qui doit être transplantée, on ne garde pas ça éternellement. Ça dépend du produit de conservation, ça ne va pas jusqu'à 7 jours. Donc ça veut dire que même si les Indiens veulent nous envoyer les cornées, il faudrait que ça arrive très rapidement ici. Et qu'on ait des gens déjà préparés ici pour attendre la cornée. Et c'est ça très important. C'est pourquoi le transfert de cornée devient très difficile. Et troisièmement, il y a la chaîne de froid qui est très importante dans cette histoire. Avec les coupures de courant que nous avons chez nous, le don d'organes devient très difficile parce que une cornée peut arriver ici et ne pas être viable. Là, nous avons fait en début d'année au CHU 3 cornées et vraiment c'était très laborieux parce qu'il fallait courir, il faut être dans les délais. Et les cornées qui viennent là, il ne faut pas que ça passe plus de 2 jours en route. Donc il faut qu'on cherche à faire un lobbying pour encadrer le don d'organes dans notre milieu, dans notre pays, non pas seulement pour la cornée, pour les reins, pour tous les autres organes.
Absolument.
Donc nous devons liguer avec toutes les autres spécialités pour ce plaidoyer. Je vous remercie.
Merci beaucoup, professeur Kamini, pour cette intervention très très importante parce qu'effectivement, ailleurs, il y a des gens qui font le don de leur corps à leur mort à la science. Voilà, donc il faudrait qu'on en arrive à là. Avant de prendre une autre question, c'est là, très rapidement, un mot.
Je vais simplement dire à Dr Kamini, lorsque le docteur notre Toshnibal présentait, il y a une question qui m'est revenue parce que lorsque j'en faisais le training, ces Américains nous avaient dit une chose il m'a dit que normalement la cornée ne fait pas plus de 5 jours. Parce que la cornée qui m'a été transplantée, c'était une cornée d'un jeune garçon de 22 ans qui venait à peine de mourir d'un accident de voiture. Donc je pense qu'on m'avait livré ces cornées en moins de 24 heures exactement. Parce que j'étais venu en courrier express. Et le lendemain, on m'a fait la transplantation. Donc parce que quand je regardais les images, j'étais en train de me poser 1001 questions par rapport à ce que moi j'ai reçu comme cours, comme directive, et ce que le docteur disait, et ça cadre exactement ce que moi j'avais reçu. C'est pour ça que je demandais, est-ce qu'une cornée peut faire plus de 1 mois peut-être dans la banque de données, par exemple?
Très bien, oui.
I just want to react to what you said about timing. It depends on the storage. There's storage medium that can last even up to 2 weeks. There's warm storage, there's cold storage that can last even up to 3 months. So it depends on the storage, what kind of storage that is used.
Merci. We will come with you just right now. Yes, sir.
Merci. Je voudrais juste apporter un complément d'information parce que quand on parle, c'est comme si on n'avait pas fait ces plaidoyers. On ne fait que ça. Je peux vous assurer que j'ai été doyen, j'ai été il y a très longtemps. J'ai même fait une proposition de loi avec quelques collègues qu'on a donné au ministère en espérant que ça va aller à l'Assemblée et tout ça. Ça n'a pas été fait. Parce que la première résistance, c'est même les responsables. Notre loi n'encadre pas le don d'organes, mais notre loi punit sévèrement celui qui profane un cadavre. Oui, parce que c'est ça le problème.
Oui, c'est encore plus grave.
Si vous-même, vous avez votre papa qui est mort, vous arrivez, vous trouvez qu'on lui a enlevé les yeux, vous allez pour... Et je peux vous assurer qu'il ira en prison pour profanation de cadavres.
Absolument.
Et c'est ça qui est le problème. Parce que, et chaque fois, ça se heurte à cette barrière-là. Nous avons fait des propositions, nous avons sensibilisé les différents ministres, parfois même les députés, ceux qui sont proches de nous, mais c'est un gros problème. Et non seulement parce que même si les médecins sont sensibilisés, il y a très longtemps, quand j'étais un jeune médecin, un jeune résident, j'ai appris à faire les greffes de cornée en pensant qu'une fois rentré au pays, je serais utile, mais ça n'a jamais été possible. Au point où je crois même que j'ai préféré effacer tout ça de mon cerveau pour ne pas souffrir de frustration. Donc on en rit, mais c'est un gros... Le problème est là, tant que la loi ne change pas, même si vous formez les gens, même si la jeune dame risque aussi d'évoluer comme moi, à la fin, si elle n'exerce pas, la médecine c'est comme ça, surtout la chirurgie, si vous n'opérez pas, vous oubliez, et les techniques évoluent et changent, vous êtes hors sujet très rapidement. Donc le problème c'est de voir peut-être qu'est-ce qu'il faut faire pour faire changer les décideurs et pour faire évoluer la législation, parce que c'est là le nœud du problème. Tant que ça n'évolue pas, tout le reste là ne sert à rien. Merci.
Alors j'ai une idée, on va applaudir très fort s'il vous plaît pour telle contribution. Alors vous demandiez qu'est-ce qu'on va faire. J'ai une idée. Lors de la prochaine élection législative, il faudrait qu'il y ait plus de médecins à être candidats pour être députés. Voilà. Donc, ils porteraient mieux ce plaidoyer-là parce qu'ils savent de quoi il est question. Voilà, ils sont au contact au quotidien des problèmes que l'absence de loi sur le don d'organes cause comme dégâts à nos populations. Bon, Dr Toshniwal, on va revenir à vous à la fin. Hein, on va revenir à vous à la fin. La dame.
Okay. All right. Go ahead, man. Merci.
Ah, ok.
Je vais...
Bon, la dame a déjà le micro.
Je vais être brève, c'est juste pour enfoncer le clou.
Oui.
Et dire que je pense qu'il faut vraiment une masse critique de personnes qui font la greffe pour que ça avance. La première greffe, à ma connaissance, qui a été faite au Cameroun, était en 1992.
Ah oui, quand même.
Les greffons sont venus de France, dans Camer, et ils ont été greffés à l'extrême nord, déjà à l'époque. Donc, c'est dire que le geste n'est pas difficile. Et ce qui a été dit, ce qui est vrai, c'est un problème de don. Ce n'est pas un problème
de transplantation.
De transplantation. Est-ce que vous savez que la transfusion sanguine, c'est un don de tissu? Il n'y a pas eu législation autre qui précise qu'on peut faire la transfusion sanguine, mais nous la faisons. Et peut-être, comme a relevé le professeur Ebana, c'est la profanation des corps. C'est là qu'on reste encore buté. Peut-être que si on donnait des globes de son vivant, je peux dire que je donne mon globe à mon frère. Peut-être que ce serait plus... Voilà. Mais il faut qu'il y ait beaucoup de gens qui fassent des greffes de cornée, qu'il y ait beaucoup de gens qui ont bénéficié et qui peuvent témoigner. Voilà. Donc, nous serons candidats aux prochaines législatives.
Oui, oui, je vous le souhaite. Oui. Yes, sir.
Okay. Thank you for this opportunity. We've talked about legislation.
Yes.
And my worry is this. Who makes the law? And for whom? What is the definition of a government? It's the people. If the people are not aware of their rights, what they need, nobody there will make any law. And even when a law is made, it might still just be a law that is not implemented. What am I trying to say? My president talked about having our first bank in 2004. I will add to this. As far back as 1973, there was a decree when Gowon was the head of state that empowered ophthalmologists to remove eyes of condemned armed robbers. That was the most available there. We never had one removed for many reasons. One of which is the thing went viral, that if they transplant the eye of an armed robber to you, perhaps you become an armed robber. So we never had one. So legislation could be there, but until the people are aware of that need, it might not work. And this is the beauty of what we are doing here. Let it go beyond this hall. On the television, on radio, let the people in the hinterland know that there is a supply here and there is a need. Where do we get donors from? Dead people, isn't it? My God. The people that refuse to donate the eyes of dead people, they remove the eyes of those that are living for issuers. I don't know whether it doesn't happen here. Remove eyes of people that are alive for issuers. We are not asking for eyes of people that are alive, breathing. We are saying this one is dead. Even talking about religion, no part of our body goes to heaven. Everything gets decayed here. But we are saying, don't let maggots eat all this. Someone can still use it, but the people are not aware.
Thank you very much. Thank you very much. Voilà, tout le monde, merci pour ces interventions. Alors, le docteur Toshniwal voulait dire quelque chose. Tenez.
Not more time, just 2 minutes. With the continuity of this, already I mentioned that 25 years before, we used to talk like this, give lectures on this. Nothing will happen. If you will donate the eyes, next life you will be blind and all that. So the awareness is very important, but coming to the very important issue related to the India, how the India can be associated. I am not a really big authority, but very important points connected to India that sir has already mentioned, that culture, religion, that will take time to donate the eyes and get corneas.
Yeah.
But Rotary clubs, Lions Club already are working with the African countries. They are coming with the material, they are staying here for 2 weeks, doing cataract surgeries. I think we should stop all these things.
That's right.
Why cataract? A brilliant, last 2 to 3 years I am associated with many African doctors. They are having the fantastic surgical hand. They are very
I think we should
good.
clap for African doctors, Cameroonian doctors, yeah?
They are very good surgical hand. Only thing is that opportunity.
Yeah.
So my first issue is surgical training as a corneal surgeon. This should be the first point. It may not be costly. Maybe we will start soon to our center also this corneal surgical training.
Yeah.
That is the first point. Second point is, apart from these laws and all that, mainly to the getting the corneas. In India, we are having, I am talking off the record, surplus corneas.
Right.
The statistics is different, that such a blind people and all that. Because of the some laws and all that, I cannot give to the nearby country, nearby state, like that.
Yeah.
It's not like that. You have attended, Mr. Akbar, you have attended the G20 meeting.
Yes.
Now you are connected with the good authority of the people, so you should mention this, that we need corneas. You just write one email to the concerned authority, you will get a number of corneas at Cameroon also, and they will be free.
Thank you very much.
Believe me.
Thank you. Please.
I think the biggest way to convert people, the biggest way is to get somebody who has done a corneal graft, talk to them, like the young lady here.
Yeah.
It is magic. And they will listen, and they will be so that. And you could tell them that their family member who's died will help people see better. And a lot of people will want to do that. So the biggest way is the recipients, let them go and preach to people the importance of having a corneal graft. Thank you.
Jean-Bruno, I think that these are very, very wise words coming from those who have started the banking some years back, and they're giving real excellent strategies. The president just said that we need to have those who testify, okay, of what, I mean, the goodness of the cornea transplant and all of that, and that will make the magic. And Dr. Toshniwal also came in with the legislation thing that it should be a global fight at a global level. At some point in G20 meetings, which we have been able to attend to talk about these things, it can be the place where eye care and cornea blanking can be discussed apart from the normal malaria and HIV and COVID things. We think that it's time that eye care and cornea blanking be discussed in these major meetings. Jean-Bruno.
Thank you very much. Alors, je pense que la responsabilité d'un État, c'est de transcender les considérations religieuses, culturelles, qui en général sont individuelles, pour passer à quelque chose qui peut être d'intérêt général. Et l'intérêt général, c'est la santé oculaire des citoyens de ce pays. Donc, vivement que la loi évolue sur le don d'organes, que ce soit pour les yeux ou alors tous les autres organes, afin que les corps de nos défunts que nous aimons bien servent quand même à quelque chose. Voilà. Voilà. Mesdames et messieurs, merci. Il est l'heure de mettre fin à ces échanges très intéressants sur une problématique très intéressante. Également, je vais vous demander d'applaudir le docteur Toshniwal qui nous vient.
Thank you very much, Dr. Toshniwal.
Très fort. Il est spécialiste de la cornée. Juste à côté de lui, le docteur Abiola qui nous vient tout droit d'à côté, le Nigeria. Merci. Il est le président de la Société nigériane d'Ophtalmologie. Thank you, sir. Et juste à côté, la dame avec les jolis yeux a été greffée de la cornée. Et vous voyez, elle se porte très bien. La greffe, elle a prise et ça marche très bien. On applaudit. Juste à côté, c'est elle qui a diagnostiqué son mal avec le docteur Manga. Ah oui, vous n'étiez pas là. Ah, ce n'était pas vous. Ok, bon, c'est pas grave. Voilà. On va applaudir également le docteur Shea, voilà, qui est également spécialiste de la cornée. Et juste à côté, Bernard, merci, thank you, sir.
Thank you
et
very
Bernard
much.
qui est membre de l'Agence internationale pour la prévention de la cécité. Vous voyez, il n'est pas médecin, mais il maîtrise les questions d'ophtalmologie au bout de ses doigts. Thank you, sir.
Jean-Bruno, thank you very much. Thank you. We just want to, if you permit me, pay homage to CHU for starting this. It's a great thing. Please, I don't know if you can clap for them, CHU. And also for Maghrabi ICO, Cameroon Eye Institute, that have also been doing, and the chain is going on. Thank you, Jean-Bruno.
Thank you, sir. Mesdames et messieurs, merci et je vous souhaite un bon congrès. Merci.
Vous ne partez pas encore, vous ne partez pas encore. Il a présenté tout le monde sauf lui-même. Mais je voudrais te poser une question, Jean-Bruno Tagny, puisqu'il
Ce n'est pas un
s'agit de
piège,
lui.
j'espère.
J'espère qu'il n'y a pas eu d'arnaque dans les échanges de tout à l'heure.
Absolument pas, pas d'arnaque.
Merci beaucoup. Merci. Vous allez vous retirer sous les applaudissements. Avant, on nous disait que la vérité sort de la bouche du blanc, mais de plus en plus, cette vérité sort de la bouche du noir et de la Société camerounaise d'ophtalmologie qui grandit. Je pense que c'est le professeur Ebana et le professeur Bella qui doivent être contents de savoir que hier, ils ne dormaient pas, mais aujourd'hui, ils peuvent dormir d'un œil. L'autre reste ouvert quand même.